Hello, my name is Victor Ringo, and I'm the project manager for MiFriendly Cities at the Coventry Refugee and Migrant Centre. And today I'm going to be talking about the Health Champions Project. As part of the Active Citizenship Brief, we recognised that access to health services and to professional and trusted medical information and best practice was critical in empowering individuals and ensuring a flourishing community. We then identified community leaders and individuals strategically placed within support organisations and the wider migrant community with a passion for supporting and strengthening their communities. These individuals were trained to become health champions. Their role was simple: provide support and share health messages, and also act as advocates or bridges between migrant communities that have often been described as hard to reach and hard to engage, and colleagues from public health and the NHS. And so, the journey of the health champions began. The first step of that journey was recruiting health champions. To do this, we advertised the role of health champions, asking people from migrant backgrounds and others if they would be interested in playing their part in improving access to and use of health services among migrants and refugees in the region. We relied on our network of project partners, as well as other organisations like Carriers of Hope, to help us advertise and help identify potential health champions. We had a very impressive response, including from many participants with backgrounds in healthcare. After our health champions were identified, the next step was to train them. The recruitment exercise finished in 2019, and then our partner, Coventry University, one of 11 partners on the project, created and delivered a 4-week training program led by a professor in public health. This led to a first cohort of health champions attaining a level 1 qualification in health improvement, certified by the Open College Network. After our health champions were trained, they started to engage. Across all 3 cities, they worked very hard to reach their communities with key health messages from local and regional health professionals. They were sharing leaflets, having informal conversations, and using social media to connect with their communities in a style and a language that they could respond to. Our health champions also took advantage of the natural gathering places to reach as many people in the communities as possible. They held drop-in sessions at the Coventry Refugee and Migrant Centre, where they spoke to clients who were waiting to be seen by their advisors about their health and ways that they could improve their health. They provided signposting to local GPs and other relevant health services. Our health champions also had appearances on Hills FM, a local radio station in Coventry that serves the areas of Bowles Hill, Hillfields and surrounding areas, which have very high concentration of migrant communities. They also attended local surgeries, community centres, places of worship, and even local barbers and hairdressers to share the messages and ensure that the communities were able to be as healthy as possible. But they didn't stop there. In addition to providing key health information and key health messages, they also provided practical support to migrant families to ensure that they could stay as healthy as possible. In these photos, you can see Mary Thomas, one of our health champions from Wolverhampton. She had identified a number of migrant families who were unable to provide presents for their children at Christmas. She then started work to try to help these families. This snowballed until they had sourced presents for over 80 children, identified by 4 of our health champions in Wolverhampton. And with the help of our project partners at the Refugee and Migrant Centre for Birmingham and Black Country and the Wolverhampton City Council, they delivered these toys to all of these families, ensuring that they could have a good Christmas. Here's a photo of Jojo Awona, another one of our Wolverhampton health champions, receiving Christmas presents to distribute to migrant families. But rather than hear me talk about the work the health champions have done, it would be great for you to hear from one of our health champions. Meet Farisai, a health champion from Wolverhampton, and hear what she has to say.
My name is Farisai Zemwa. I live here in Wolverhampton in an area called Bilston. I'm a mental health nurse by profession, and I originally come from Zimbabwe. I came here to sort of better my options, and I'm really passionate about becoming a health champion in my community. Different things can impact your health, and if there is that group of people that can help people to address different areas of their problems so that they have optimal health, is a good idea, and that's what this course was all about. So I got to listen to different views about health in general and different views about social engagement and social interaction and how it can affect lives health-wise. And I also loved it because it gave me an opportunity to air my own views on, health in the community especially. If the more people we have championing good health in the community, the better, because so far I think it's an area that has been lacking. And if we start looking at addressing health issues in the community, we also help health service providers by preventing a lot of, like, for instance, hospital admissions or readmissions for that matter, because then we are directing people to the right services for the right things. There's quite a few areas of concern, and most of them are, I think, lifestyle-based, which then lead to affect different aspects of your health. For instance, homelessness is an issue which impacts on your health. Drug abuse can start in a way to cope with homelessness. And it also impacts on physical health, because you get things like liver diseases that comes from the overuse of alcohol, lung diseases that come from overuse of alcohol and drugs. So I found that in this course, we actually got to discuss a lot of those things, and we got to talk about how we can help either reduce, correct, or prevent completely. MiFriendly City, to me, from the name itself, means we're trying to get our communities as friendly as possible. And I don't just mean friendly in terms of friends as in interaction, but as user-friendly as possible, especially health facilities, health services, health education, and health improvement. If there's a friendly atmosphere, people are not afraid to access these services. So that's what MiFriendly City means to me.
As our health champions continued to gather momentum, we were suddenly hit by a global pandemic that affected the way we all worked and lived within our communities. With the introduction of nationwide lockdown measures in March 2020, our face-to-face community engagement came to a crashing halt. The pandemic also brought with it a number of other challenges. Digital exclusion, for example, meant that a lot of our health champions and the communities that they served were not able to get online because they didn't have access to the right devices or to Wi-Fi or mobile data. There was widespread fear and panic as well across all communities, and we started to see the emergence of a lot of myths and fake news about the pandemic, including some myths that the government would be spraying insecticides across cities from aeroplanes, or that sitting under the sun could kill the virus. All of this led to a distrust of information and more fear and more panic. And so our health champions got to work. The first thing that we did with the health champions was organised briefings from the Birmingham Director of Public Health. These 2 briefings for our health champions ensured that all of the questions that they had and questions that they've been asked by members of their communities could have the right and reliable answers. We also got to work combating digital exclusion. In Coventry, we secured the funding to ensure that our health champions could get online by providing mobile data monthly for them. We also set up a steering group in Coventry, made up of professionals from public health, the Coventry City Council, and the Coventry Refugee and Migrant Centre to coordinate the response of our health champions and the response within migrant communities to the pandemic. We went a step further and had more briefings with all of our health champions delivered by the consultant in public health from Coventry. And then we trained a second cohort of health champions. This led to stronger, more established health champions group that was relied on by many organisations to help permeate the hard-to-reach migrant communities, and a closer working relationship with health officials from local public health and the NHS. We also continue to provide practical support to combat the problems introduced by COVID-19, including rising rates of food poverty within our communities. Here is Mary Thomas again, working to prepare and deliver food parcels to migrant communities needing help during the pandemic. We also changed the way we engage, utilising social media platforms. We started to engage with our community on WhatsApp groups, Facebook groups. We created podcasts and Zoom sessions to ensure that the right information was being passed along and that fake news and myths were combated at every point. We added practical support, including referring people from the community to organisations that could provide digital equipment and data, further helping to combat digital exclusion and making sure that everybody had access to the resources that they need to receive the information and help that they need. We translated messages from public health into various languages. And in Refugee Week of 2020, our health champions produced a video in 6 languages, helping to explain what they did and helping to reach more members of the community. The videos were produced in English, Punjabi, Arabic, Farsi, Chinese, and Romanian. Here they are.
Hello, I'm a member of the Health Champions team, a group of unpaid volunteers living in the Coventry community. Good mental and physical health is essential for everyone in order to live a good, full and happy life, and our service is open to everybody.
السلام عليكم، أنا عضو في فريق بطل الصحة، وهم مجموعة من المتطوعين بدون أجر يعيشون في مجتمع كوفنتري.
您好，我是一名健康支持者团队的成员。团队大部分志愿者是移民，我们的服务是免费的。
سلام، من عضوی از تیم مبارزین یا حامیان سلامت یا هلث چمپیون هستم. ما گروهی از داوطلبین دور دیده مشغول به خدمت در استان وست میدلند و شهر کاونتری می باشیم.
मैं हेल्थ चैंपियंस ਦਾ ਇੱਕ ਮੈਂਬਰ ਹਾਂ ਔਰ ਅਸੀਂ ਕਵੈਂਟਰੀ ਦੇ ਵਿੱਚ ਰਹਿਣ ਵਾਲੇ ਲੋਕਾਂ ਦੀ ਸੇਵਾ ਕਰਨੇ ਆ। ਇੱਕ ਖੁਸ਼ਹਾਲ ਜ਼ਿੰਦਗੀ ਗੁਜ਼ਾਰਨ ਵਾਸਤੇ ਅੱਛੀ ਦਿਮਾਗੀ ਔਰ ਜਿਸਮਾਨੀ ਸਿਹਤ ਸਾਰਿਆਂ ਵਾਸਤੇ ਜ਼ਰੂਰੀ ਹੈ।
Bună, eu sunt un membru al echipei de campioni pentru sănătate, un grup de voluntari neplătiți care trăiesc în comunitatea din și de pe lângă Coventry și Birmingham, Marea Britanie.
Una dintre provocările cu care ne confruntăm acum este pandemia de coronavirus. Imigranții sunt cu mult mai vulnerabili decât localnicii prin faptul că nu au acces la informații sau nu știu unde să le caute.
Our health champions then went on in Coventry to receive funding from the Coventry City Council Public Health team to allow them to go on further training, and this led to them receiving level 2 qualifications in health improvement from the Royal Society for Public Health. In addition to this, the public health team in Coventry and the Coventry Health Champions Steering Group organised a range of sessions with different leaders from public health, helping to train the health champions on a variety of topics and design campaigns around these topics. Some of these topics included immunizations and flu, tuberculosis and viral hepatitis, domestic violence, parenting, and mental health, amongst others. As the MiFriendly Cities project is coming to an end, we have started to look towards the future and started to plan for the work that we're going to be doing beyond the end of the project. In Wolverhampton, the City of Wolverhampton Council MiFriendly Cities team, members of the Public Health Department and Black Country Healthcare continue to hold monthly meetings with our health champions. They have created a legacy plan to ensure that the health champions' engagement and activities will continue. In Birmingham, supported by the Birmingham City Council, our health champions are creating a community interest company to ensure that they can continue to serve their communities. They are also keeping up their engagement with the Birmingham Public Health team. In Coventry, our steering group has grown to include members from the local police force and other organisations. The Coventry City Council has also convened a wider group of organisations working on health champions projects to ensure that we can all continue to support one another. We have also secured funding to keep our programme going for the next year. Coventry Refugee and Migrant Centre will continue to manage the health champions, recruiting a dedicated health champions coordinator to make sure that this work is done as well as possible. We will also continue to work with all of our project partners across the region. Our health champions have started to take a lead, identifying opportunities for further training and advancement to ensure that they have all of the capacity that they need to continue to do the brilliant work that they're doing. Thank you.